Okay, thanks for watching this video. If you're watching this video, I know you're passionate about saving arms and getting arms healthy, and that's exactly why I created PocketPath. And I really feel there's a huge need in the PT and medical field to be able to implement this to get kids out on the field healthier. So my thought on this has always been an athlete, especially the youth athlete, comes in, sore shoulder, sore elbow, probably not serious yet, but it is aggravating. So they go to a doctor, they get diagnosed for that injury, then they get sent to physical therapy, and physical therapists can easily see what the problem is. They can see the weakness in the rotator cuff, the scaps, the rhomboids, the traps, anything that's sitting there on the shoulder that doesn't look like it's as strong as the other side, all the imbalances. So for me, when I had an injury, I went to PT, I came out of PT, and I'm throwing better, I'm throwing stronger, I'm throwing harder. We've heard that story a million times. Problem though is, when I see that in kids, is that they go back through a cycle. So they go from medical doctor diagnosis to PT, PT gets them healthy, and then some physical therapies have a really good background in throwing and they understand it really well. Most though might be coming from a fitness side of running, or they're just really good at what they're doing, but they may not understand the dynamics of the pitching delivery or the throwing delivery. So what they'll end up doing commonly is send them for a throwing program and then maybe tell them to go get a pitching coach to make sure that they're not back in here because of poor mechanics. And that could be the worst thing that you could have told them. That might even be the reason why they're in there. There's tons and tons of ideas on what the right throwing path would be, but PTs, medicals, they understand biomechanics, they understand the anatomy, and if you understand what the PocketPath system does, it puts that athlete in a really simple, strong throwing position. And I feel like at that stage where you, as a PT, is releasing that athlete to go into their throwing program, this is a perfect time to implement a constraint system that allows them to repeat their throwing delivery, to understand it better, and to be able to take that home and work on it at home without a ball, just going through the throwing motion before they get the ball in their hand and start their throwing. And that's the way the PocketPath is used in Major League Baseball now. So we've had about 4 teams now who are using this system to be able to take a TJ or a labrum surgery, someone who's been off for quite a while because of a surgery. They've gotten back to full strength. In 2 to 3 weeks before they start throwing, what they end up doing now is they're going to go through, put the belt on, put the sleeve on, and start to go through the throwing motion without the ball to get them more confident and let them transition to throwing a little easier. So what I'm going to show you today, I'm going to go over to the wall, show you how you can use this without the ball, with a plyo ball, and then joining with a baseball. So that way early in their throwing phases, they can start to create the awareness and the feel of either their old delivery or a better delivery that's going to sustain for health and longevity, so they don't have to come in and get hurt again and be in the physical therapies and medicals and all the different things that we've seen. So that reoccurring injury doesn't happen again. They can get rid of that and play this beautiful game for as long as they can. I'm going to send you over to the plyo ball wall and I'll show you all the drills that we do